Hello, and welcome back to Patient Conversations with Leah. This is our second episode of a three-part series with James. James was diagnosed with stage 4 lung cancer in March of 2024. In our first episode, we talked about what it was like to get that diagnosis as a strong and healthy individual, young person. And then not only that, but how to be your own advocate and the value of second opinions. Today, we're going to focus kind of like on what this experience has been like for him in terms of treatment. So James, welcome back. And I'm just going to let you start by kind of telling us what your treatment has been like over the last 18 months.
Sure. Well, from the initial diagnosis, him was a big shock, and we weren't exactly sure what the path forward was going to be. So the first step was to get back the genetic profiling that we had done from that biopsy. And when that came back, it revealed that I had a very specific mutation. In my case, it was EGFR exon 21 L858R. That is a mutation that they actually have a targeted therapy for. So over the last decade plus, they've developed different different drugs, different TKIs they call them, that work on different mutations. Most people are familiar with chemotherapy, of course, and that was part of it. They do studies and they do trials, so the treatment options are evolving all the time. And in my case, FLAURA2 trial had been concluded. All the study results had been published, and the FDA had approved that treatment option literally weeks before my actual diagnosis and discovery of my mutation. So for me, they said, okay, we're going to start with systemic treatment, which means we're going to treat the whole body first. The reason that particular study's results were important to me is because it allowed me to do chemotherapy, dual agent chemotherapy, simultaneous to taking that TKI, that targeted drug. So I started them both at the same time, which is something that previously wasn't approved to do for first-line treatment. The consequences of that is that you're taking a pretty powerful anti-cancer drug that has its own side effects, and then putting it on chemotherapy, which everybody's familiar with, has side effects. Modern chemotherapy, again, in the first episode, we were discussing the lack of knowledge, personal knowledge and experience with cancer. So my idea of what chemotherapy was going to be was a little different from what I actually experienced. A lot of people have a very frightening image of what chemotherapy can mean for them. And I'm not going to downplay it. So it's a serious therapy. And I did 4 rounds of dual agent, carboplatin and pemetrexed are the name of the drugs. And they are quite powerful. There will be some side effects. You'll have fatigue, nausea, not so much in my case. That was very well controlled. And mainly it was just fatigue was the biggest side effect that I experienced. But I continued to work full time the whole time I was on chemotherapy, and taking the Tagrisso. That's the brand name of the targeted therapy that I take. And so those things together were pretty powerful. Was designed to get me to a point that we could see if I was going to be a candidate for surgery. In my case, I responded well to the therapy. The targeted therapy crosses the blood-brain barrier. I had a primary tumor in my upper left lobe of my left, lung, and I had a brain metastasis. So I had a brain tumor kind of about here where my index finger is, on the front left lobe of my brain. And both of them were sizable enough that they were quite intimidating looking. When you look at the CT scan, I think you go, oh my gosh, this is concerning. They both responded very well to the therapy. Both of them shrank. The brain tumor particularly, osimertinib is very effective against that, and it reduced its volume by 80%. It's possible.
Pretty amazing.
Yeah, it was incredible. And that was from one scan to the next. So a 90-day period, that tumor shrank tremendously. So did the lung tumor. The team was very encouraged by those responses. They said, okay, given your overall level of fitness, your age, your just who you are, because they evaluate you as a patient, they said, okay, you are definitely a candidate for surgery. So we're comfortable to do it if you want to do it. They also offered and did a consultation with radiation. We said we can do radiation instead. That's when I talked about in the first episode, you're offered options and decisions that you have to make. So they'll offer you their thoughts about it. You can look at statistics, but ultimately it's your body, your life, and you have to make that decision. In my case, there were a couple of concerns for the surgery because it's in my left lung. Your left lung only has two lobes. So they said, we plan to do a lobectomy, which is to remove the upper lobe where that tumor is. But the tumor is located on the artery. So it's right on the pulmonary artery and wrapped around it, very close to the heart. So they said, well, if it's possible, we'll save the lower lobe. If it isn't, this will turn into a full pneumonectomy, take out the entire lung. So I knew that was a possibility going into the surgery. That is ultimately what happened. I had my entire left lung removed. Now, I was a fit person going into it, so I can still run like a 9:25 mile. I can still do my full workout that I did before.
That's awesome.
Probably on a spherometer test, I'm around 85% capacity for, where I was before, which is mind blowing to me. The
Yeah.
upper lung actually grows in size. I won't go into a whole anatomy class about that, but it actually takes up some of the space of the old lung.
Oh, it's fascinating.
Yeah.
When you see the scan and you see the x-ray, when you first have it
Mhm.
done, and it's like, here's your little lobe over here, and there's this area of nothing. And then each day it's getting bigger, and then you eventually see it, and like you can't even tell that there's anything missing.
Right.
Very
Now,
cool.
in my case, with the entire lung removed, you can, it, it really did expand. And as far as my outward physical appearance, nobody
Right.
would know anything at all.
Right.
You know, only through a CT scan. I mean, you go, oh, that's peculiar. But as far as my everyday life, my ability to lift weights, run, do all that kind of thing, I just get shorter of breath a little quicker than I used to. That's the only side effect I've had. But to get there was climbing a hill. The I will be honest. So you do in my case, I did the chemotherapy with the targeted therapy, did that for a few months. They reevaluated. They said, okay, the brain tumor has tremendously, both of them have shrunk. Your candidate surgery, which do you want to do? Do you want to do radiation or do you want to do surgery? Everything I read at the time indicated that surgery gave longer overall survival results. So I said, okay, let's do that then. That's the case because I've got young children. I want to be around as long as possible. However, there's also a risk that as your body heals, that some of those micrometastases, these little cancer cells that are all over your body now, at stage 4, it means the horse is out of the barn. So
Exactly.
the tissue of your body, part of your body's natural healing process might trigger tumor growth in other places. And then I go polymetastatic and have more tumors. So there was a risk there. So again, the choice is yours. You have to just do your due diligence and decide what you think is appropriate for you, what fits your life, what fits your lifestyle, your health at the time. There's no easy answer. There's no right answer. It is completely between you and your medical team, and you'll make the decision that's right for you. In my case, like I said, from the beginning, I really had a visceral get this out of me kind of feeling about it. So I didn't hesitate. I said, yeah, we'll do the surgery. Absolutely. Do it. So we went in, we did the surgery there at that cancer center and the recovery of the surgery. But, I woke up back in my hospital room and they immediately want you to stand up, take a few steps, move around. And it was, in my case, there was a complication during the surgery. It isn't completely risk-free. So I wound up having 2 surgeries actually within a few days. They took out the top lobe. There was a complication, clotting issues. They were concerned about, stroke risk. So my temperature skyrocketed, et cetera. So they took me back in and they had to open me back up just a few days later and take out the bottom lobe as well. And I told the doctor at the time, and I got along great with my surgeon. What a amazing human being he is. Absolutely fantastic. And we had very similar backgrounds, both helicopter pilots, both been in the military. He had been in the Canadian Army as a surgeon for years before coming to Indiana. Both scuba dive, open water scuba divers. We had all these things in common. And terrific guy. And he's also a cancer survivor himself. And so incredible person. And I was telling him, when they came in to tell me, they came in as a team and said, they explained the situation and explained that they needed to go back in. And I said, in the Army, we do these group runs. You've seen it in the movies where everybody's in formation and chanting, calling cadence. And I used to lead those kind of runs on a regular basis with, hundreds of soldiers. And we would move the finish line sometimes. So you go out and run like 5 miles, and everybody's kind of looking at the finish line thinking, okay, we're going to get up.
That's it.
And then you keep going. And you'll see some people's morale break. And they, because they kind of gave everything they had to get there. And it's not done to be cruel. It's done to build resilience, to understand the job isn't done till it's done. It's not over till it's over. And so I told them that. I said, we do that. I said, and it's, you do what you have to do. So yeah, I'm completely fine with that. Yes, let's go back in, open it back up, let's do it again. So the result of that felt like getting thrown out of a car and run over and then backed over. And then, you wake up from the second surgery. But again, it's the results that I was concerned with, not the process so much itself. The results, I did have edema, had a lot of swelling, a lot of pain initially. This was the second time having a chest tube, so they had to remove it again.
It's the worst part of the whole thing, I think.
Yeah. So it's, so there was that. But the recovery was the second time around, very rapid recovery. Walking laps around the nurse's station, like the next day, and exploring the hospital, running around. And after a few days, they went, okay, you can be discharged, fly home. And immediately I started walking every day. And I said, I told my wife she would walk with me. And I said, okay, I'm going to, as soon as I feel like I can, I'm going to try to jog a few steps. Very painful. I think I ran 6 steps the first time and had to stop and go back to walking. And I was like, oh my gosh. But then the next time I ran 8 steps. And then 12, and I kept doing it. And I said, okay, every single day I will extend my distance and I'll add a few extra steps of jogging to this. So if I made it to that telephone pole on this day, I'm going to go to that mailbox the next day, the one past it, that kind of thing. And I just forced myself to do that until I got where I felt like I could do a push-up. And I did one horribly painful push-up. I do sets of 60 now. It's fine. But I did one push-up and it hurt. I just built myself back up, recovered, and now it's been just a little over a year since the surgery. And if you met me in the street, you would never know anything.
That's awesome.
And
so what is your treatment
Yeah,
I'm sorry.
My treatment now is I only take 1 pill a day. I take the osimertinib. After the surgery, they send you home, painkillers and gabapentin and
Muscle relaxers,
everything. And I weaned myself off that as quick as I could. And just got down to just Tylenol and then weaned myself off that until I was just back to osimertinib. And that's Tagrisso. And that's it. That's all I take now. That, and I just do my own supplementing.
Yeah, that's awesome. Obviously, living a life, you've been on treatment for some type of treatment for 18 months now. You've recovered from not 1, but 2 surgical procedures. And as science is now, there's not really any data that tells us for sure what we're supposed to do after surgery. Do we stay on treatment? Do we not? Do we change it up? So if you think ahead, because it's not easy to be on treatment, even on a TKI, there are side effects that come with that. There's the longer you're on it, you worry about the toxicity, like to your body in general, like that. But how do you think what you've been through and the treatment you're on, how do you think that will kind of, unfold across your lifetime now? Because, we're hoping that by having surgery and doing these different treatments that it's not a matter of you have 5 years or you have 6 months or you have 2 years. This is like turning this like really a terminal disease into something that's more of like a chronic disease that's managed. So how do you see this affecting you in the future, or do you?
Well, what you just said is exactly my anticipation. And that is, I think you have to go into this with a mindset of resiliency. It's critical. Hope. There's no reason not. None whatsoever. Because for every given situation in life, there's always a minority that super achieves, another subset that does fantastic. There's others that don't do so well. There's just the whole spectrum. And there's no reason at all to believe that, especially initially, why take on the personal weight of, oh no, this is going to go bad. You don't know that. And there's something that actually I think you hosted with 2 of the doctors from MD Anderson. And one of them said, Dr. Gay said something, I think it was Dr. Gay. And he said, there's so much we don't know. There's a tremendous, I think the honest truth is in the whole world of oncology, there's more unknowns than there are known. That's just the reality of it. They know a lot. They know a tremendous amount, incredible science and research, but there is a whole universe of things they don't know. So there's
Right.
no reason to assume that you're going to be in any category. So I take the optimistic route always and say, okay, I'm expecting good outcomes from these things. And so far, knock on wood, I always have a joke I knock on my head. Say,
Yeah, no, I do that too. I'm like, "Ugh, I don't want to jinx myself."
that I'm anticipating exactly that chronic disease management. I've been very encouraged with the results that we've received. The surgery in my case was a R0 resection, they call it. So all margins around the tissue that they remove tested clear of any active cancer. Every scan I've had for over a year now has been clear. So I am currently no evidence of disease. In the old days, we used to call that remission, and we call it full remission. And people, when they went into full remission, would be encouraged and would often kind of consider themselves cured. I don't. So I'm aware that there are micrometastases, that there's still cancer cells in my body. But I also know that the number of them has been so reduced, so attrited. Osimertinib is a powerful drug,
And hopefully manageable,
and I believe it is manageable. And because
because
you're
now you're looking for them every time you
correct.
have a scan.
Oh, and I'm sorry, part of the treatment that I did too, I actually omitted this earlier, is I did do gamma knife radiation to what was left of the brain. Because they can only observe through MRIs. So the MRI, they don't know, is that scar tissue they're looking at, or is it still something active in there? They can't tell because it's just observational. So I elected, hey, let's remove all doubt. Let's hit that too with radiation. Exactly. Why not? So that just removes the doubt. So I know, again, and it goes back to my vision for the future. I know that I've thrown the kitchen sink at this. We've done radiation, we've done a major surgery, we've done targeted therapy, we did pretty hardcore chemotherapy. I've done everything that can be done at this point. And that has brought me to a point where I, right now, live a completely normal life. I take a pill every day, just like many millions of people with other chronic diseases take some kind of daily pill. Some people take more than that. Some people have less serious disease, but they have more interruption of their daily life to treat it. In my case, it's a stage 4 cancer diagnosis, but my actual treatment right now is one pill a day and I get on with my life. That's
Yeah.
it.
Pretty amazing, isn't it? To
It's
think of
absolutely amazing.
where we've come, and even that I've been in this for 5.5 years, consolidated care was not an option when I was first diagnosed. So just in 5.5 years, the thinking has changed. Where are we going to be in 5 years from today, or 10 years, or 15, or 20? There's a lot of hope to be found for sure. I know that, not to sugarcoat it, because there are patients that have high tumor burden or don't respond to treatment well. But, I think the hope is that when you're first diagnosed, you've got to hold hope
Yes.
that you are going to have a successful treatment option or plan. I think that's where it starts, is just not giving up before you're even put in the game. So I agree with you. It's not an easy path to get here. And it's not going to be necessarily, we still do the scans. You still have to worry about that and think about that. But it is definitely not what I like to say is your grandfather's lung cancer anymore. It's not a death sentence necessarily. I think that is, hearing your story, I think, will give a lot of people that hope. So I appreciate you being here today and sharing that with us, because it is important to hear. Think a lot of times human nature is people like to talk about the terrible and bad things. And, we also need to hear the good, and that you're doing well. Even, having your whole entire left lung removed, you were still able to recover and live a full life. So again, thank you for being here today. And, this kind of will lead us into our next episode, which is one of the main reasons James is so determined, I know, is because of his wife and his children. So in our next episode, we are going to talk to James about kind of how does this affect your family, and how do you talk to kids about this. So I look forward to that, and make sure you like and follow so you don't miss episode 3, and that you can find episode 1. And James, again, thank you for being here with us today.
Thank you.